physicians, dentists. Doug is an DMD. We've got Pat, who's an MD. So we've got everybody, and we've got, I'm sorry if I couldn't get to your name because there are way too many of you out here to get everybody my name, but we're going to get going because we got a lot to do. Anything you can do on your side to go ahead and limit whatever streaming or anything else, because we've got a very, very precise video. We want to really break down what people think is going to be just such an easy technique, but it's not, and you'll see why. And you'll see how you can make it much better. So let's go ahead and start this microbotulinum toxin precision lip flip. It's going to be about precision. It's going to be about predictability. And it is great for you to tune in, and really, really appreciate you all being here with us. And I just want to go ahead and thank you all for being with us. And it is really wonderful. Let me just see what happened to my power here. So let's hang on just for me for a second. Well, I go ahead and try to figure out why I am stuck, but that's par for the course, I guess. This is what happens over time, and life's crazy. When you think it's going really good, that's when life can be kind of kooky on you. So hang on, let me just make sure something is really plugged in so that we will have power for everybody, and we don't lose you in the middle here. So give me a second. Okay, hopefully that will do the job for us now. And so let me just get this back up here for that. Oh, it's always something. Hang on a second. Now let me get rid of this. Okay, everyone's still there, right? Tell me you can hear my voice, you can see my screen, and if you can, then that would be just great. So I just want to make sure everything's working on your end because power's a little kooky here. So tell me you can still hear my screen. You can see me, you can hear me, you can hear my screen. You should see my screen. You are all muted, and we are good to go from there. So with that, let's go ahead and go. There's my information. Take a photo of this screen. Lots of websites there that you can refer to. So I'm just going to let you do that. And we certainly invite you to any American Academy of Facial Aesthetics training. As you can see, a very happy crowd right there as well. And please follow us on Instagram, Facebook, YouTube, and TikTok as well. That would be great. And certainly you know about AFE trainings, live patient certification training. That's what you should be looking for, and we hope that you will join us. And many of you are AFE members, so really thank you to all of you for being part of AFE members. And there is the latest. Again, I don't want to spend any time with this. All of your training questions go right here to afetraining.com. But what is really important about this too is the fact that you have got is the fact that tuition is definitely going up. There's no question about that. So if you want it, grab it now because, I mean, certainly in a few days, that tuition is going up. Unfortunately, like everything else in this world, that is going up in price. But there you can see through the end of the year, and they've got all of 2020. They've got all of 2023 already scheduled there. So if you're looking for it, then that's really what we'd love to have you at the course. So with that, let's get going on our topic right here. It's the injector plus the neurotoxin. We are going to talk about that microbotulinum toxin lip flip. And it's a very precision, very predictable. If you know the anatomy, safety, and technique, it doesn't matter what the neurotoxin is. I probably will flip between microbotulinum toxin, microbotox, but I can mean any of these different botulinum toxins. And by the way, I mean, they're all good. They will all work really, really well for you. But it's really, this is going to be the technique, and it's going to be what's in your hands. If you really understand the anatomy, we're going to delve into the anatomy. And I can tell you that I think most of you are going to be very surprised at what the anatomy of the lip really is when it comes to microbotulinum toxin. You're going to be super, super surprised for all this. But I don't care which one you use. Certainly Botox is the leader. Xeomin is a close second, less expensive. You don't have to refrigerate before reconstitution. You do afterwards. Some of you, like Jeuveau, may not be as predictable in everybody's hands. Definitely needs a little bit of tinkering if you start to use it. Dysport, many of you know, it doesn't really matter What's important, though, is when I talk about units later on, I'm going to be referring to the Botox type units. Botox, Eamon, Jeuveau. Dysport has about a 3-to-1 unit equivalence there. So I'm going to let you figure that out for yourself. But I'm going to talk Botox units, and that's the language that we're going to go ahead and talk about as we go through this program. So you know, but you should know the science of tox, right? What is the science of tox? It's about binding to that neuromuscular junction here. But here we're going to be so specific that we are going to go ahead and affect only a part of the orbicularis oris muscle without affecting the deeper part. We're going to be superficial, and you're going to be really surprised, like I said, what that really is what it's made up of. But how does botulinum toxin work? You know, it will go ahead and prevent motor muscle movement when you inject it. 2 to 4 hours is really important. The first 2 to 4 hours, you don't want to mess around with it. You certainly don't want to move it around, especially in this technique. You do not want to move things around. You want to make sure that the patient does not touch it after you inject it for a few hours there, and then 2 to 10 days to really start to kick in. This actually will kick in, you will find, a little bit quicker because it is so specific when we get into this. Now, again, this is lip anatomy, just the general lip anatomy. What are we looking at in terms of general lip anatomy? Nice aesthetic lips, and really we talk about this kind of a slide more along the lines of filler for that. But what we're really looking to accomplish with microbotulinum toxin lip flip is get more lip show, more vertical height, showing more of that vermilion as you can see. And we can pick up that Cupid's bow a little bit. We can show more of that as it comes up to the cutaneous part. And we're going to show you microbotulinum toxin with filler, with PDO threads, and how you put the whole thing together here. But it is about having nice aesthetic lips, and certainly it works with filler there as well. But you want, you know, that soft tissue occlusion where the upper and lower lip come together. You want it pretty much straight across. There is a little bit of a shape to it, kind of like a swoop, seagull shape between in that lip occlusion that you see right there. But you want that beautiful pout as it comes out and around. You want that really nice definition between vermilion and cutaneous. And you want more lip height and lip show, and that's exactly what we're trying to accomplish when it comes to botulinum toxin and using that. Because again, really beautiful lips takes all of these things together, right? I mean, many of you certainly know that for that. But what you're going to be surprised at is that the orbicularis oris muscle really is a muscle made up of many other muscles, and there is a distinct superficial part of it and a distinct deep part of it. So let's really get into this. And what we want to accomplish, I'm going to try to keep making this point so you understand this. What we want to accomplish with microbotulinum toxin lip flip is, and the AFE technique, and I can tell you that we were one of the first ones to do this going back to 2011. We were demonstrating it, talking about it, doing webinars on it for that. So, I mean, we've really perfected this over time for this. And it's really about understanding the muscles here. What we want to do is we want to go ahead and get the superficial fibers of the orbicularis oris, wherever they're coming from, and go ahead and either put them to sleep or really, really reduce their intensity of contraction and their use so that the deeper fibers of the orbicularis oris, and you'll see where it's made up of, is going to then recruit a little bit, push harder, and that gives you that lip flip. That's what gives you that lip show. So, and again, I know many of you know, and many of you are AFE trained, we are anatomy crazy because the truth of the matter is the secret sauce of great injections and great results, aesthetic results with anything, but really with lips, is going to be the muscle anatomy as you're going to see. So where does this come from? Where is the orbicularis oris come from? Well, the deep fibers, you may be very surprised to learn, is really the buccinator muscle. What's the buccinator muscle? You'll see it in action in just a little bit. You all have it. It's to feel the inside of your mouth on the sides, and you are feeling not the muscle itself, but what's covering the muscle, the mucosa there. But right underneath there it's the cheek muscle. It's that buccinator muscle there. that really holds your breath in. As you see, if you try to expand out your cheeks, that buccinator holds it in. But as it gets to the modiolus, the corners of the mouth, it flips. The upper buccinator actually becomes the lower deep orbicularis oris, and the lower buccinator fibers become the upper deep orbicularis oris. So that's the deep part of the muscle that we really are going to count on to recruit a little bit to give us that lip flip, as you're going to go ahead and see. That is also the muscle, though, that's responsible with the superficial fibers, but really it's the deeper muscle that are more responsible for the radial lip lines, smoker's lines, water bottle lines, right? That deeper injection of the deep orbicularis oris, that's how you go ahead and take care of radial lip lines, smoker's lines, water bottle lines, whatever you want to call them, and really soften them. Then you can go back with filler if you want. You can go back with microneedling, smooth PDO threads to finally get rid of it. But you can get some really, really great results just by the use of botulinum toxin for radial lip lines. That's not the technique we are talking about. We are talking about lip flip. So we're going to get into that just a little bit. And as we talk about lip flip, as I said, we're going to show you right now in this anatomy video, let's see where those superficial fibers are really coming from. So here we go.
We'll move on to look at the muscles of the cheek and lips. The muscles we'll look at are the buccinator, which forms the muscular lining of the cheek, and the complex of muscles that surround the mouth, collectively called the orbicularis oris. Before looking at these muscles, we need to get acquainted with a ligamentous structure that the posterior fibers of the buccinator are attached to, the pterygomandibular band, also called the pterygomandibular raphe. The pterygomandibular band, represented by this piece of material, passes from the pterygoid hamulus to the posterior end of the mylohyoid line. Two muscles arise from it, the buccinator in front and the superior constrictor of the pharynx behind. The pterygomandibular band can stretch to accommodate jaw movement. Now, to see the muscles of the cheek and lips, we'll look at a dissection in which the skin and subcutaneous fat have been removed from the lower part of the face. The muscles of facial expression have also been removed. Here's the orbicularis oris. Here's the buccinator. The two are closely associated. We'll look at the buccinator first. Here, it's partly hidden by the masseter muscle, which we'll remove. The buccinator is a thin pouch of muscle that closely follows the contours of the mucous membrane of the vestibule. It has a long line of origin. The buccinator arises from the maxilla and from the mandible along these lines. Above, the line of attachment curls round behind the tuber of the maxilla. Below, it curls round onto the buttress of the mandible. Between these 2 points, the most posterior fibers of the buccinator arise from the pterygomandibular band. The buccinator muscle passes forward and divides at the corner of the mouth. Its fibers continue forwards to become the deepest part of the orbicularis oris. The orbicularis oris muscle complex surrounds the opening of the mouth. It consists partly of intrinsic fibers, but it's formed mainly by the fibers of other muscles, on the deep aspect by the continuing fibers of the buccinator, and on a more superficial level by these muscles of facial expression. We'll take a good look at them in the last section of this tape. The action of the orbicularis muscle is to press the lips together, closing the mouth. The action of the buccinator is to prevent the cheek from distending when we raise our intraoral pressure. When we let the buccinators relax, this happens.
All right, so there you go ahead and see it. And anything, I know, somebody mentioned the audio breaking up on your end. It's working fine on our end. Anything you can do to prevent the streaming and anything backing up on your end, I think will really go ahead and help you here. But now let's talk about that, because made some important points here. So these are the superficial muscles that we were talking about here that he described so nicely there. And literally, this is a great dissection because you can really understand where these muscles are really coming from. So when you go ahead, and we're going to go ahead and inject the superficial orbicularis oris muscle, what you're really injecting is the insertion that's coming and the muscle fibers that are coming from zygomaticus major, as you can, that's what the two ZMs here, zygomaticus major, zygomaticus minor, the levator superioris, labia levator superioris, and the levator labia superioris aliquinesi, LLSAN, as you can see. Those are the ones that are going ahead into the upper lip, into the lower lip. You have got some of the other ones. The DLI is the primary one in the lower lip that you are dealing with, the depressor labii inferioris, but they're, again, in the lip and they're superficial, so that's where it's inserting, right? I mean, they're anchored in bone, but they insert into skin as other facial muscles go ahead and do, and that's what makes your lips go round, especially, and then with the deeper buccinator there as well. So what are we going to target? We're going to target these muscles, but it really turns into the lip muscle, and that's why this is going to be an important point. I'm going to make it only 100 times because I don't want you to have complications here because now you understand that the muscles that you are injecting in the superficial orbicularis oris really are these muscles here. You want to make sure that you are really only outside the vermilion border. If you're any higher up, because some people think, well, if I'm a little bit higher up, or if I'm, a little bit further away from the vermilion border, and I inject this, maybe I'll get more lip show. Maybe I'll get a better lip flip. No, what you will get is you will lose the action of these muscles, and on the upper lip, you won't be able to raise the lip. On the lower lip, they won't be able to pull it down and smile, and they'll look like they have a stroke. And so that is so important. It's not just knowing which muscles we're talking about, it's also the point of injection, which we're going to show you right now. But first, anatomy is everything. Come to an AFE, applied injection anatomy, inject and dissect cadaver course and ultrasound training. There are the available dates. It's $1,000 off, so I will let you go ahead and go to afecadaverlab.com, or if you buy one of those packages before tuition goes up, you can certainly use some of those the courses in the package for this as well. But there's nothing like anatomy. We inject stuff on, we do cut downs on these cadavers. It's amazing what you can go ahead and do this. This will literally change your life, especially if you are an advanced injector. All right, let's talk about the needles that we're using. We are going to use, if you've ever been to an AFE course, we're going to use Comfort Tox syringes. Why? They are the sharpest out of the box. We love them. It's the only thing we use in AFE training because patients love them, because really precision placement, and we've got to know the anatomy, but they are the sharpest by far, and the sharpest always means the most comfortable. And you can see what these look like on a micrograph right out of a box. Much sharper than anything else that is on the market. The other one is a very popular syringe used for Botox, and it's no wonder your patients hate it because it's ragged right out of the box here. But let's go ahead and show you this, because this is really a great slide, and this is from a plastic surgeon by the name of Dr. Subio, who posted this once. Emergency room, he was called in, and before he stitched it up, he got a really good shot of what the lip really looks like. I mean, you can have all the cadaver dissections in the world, but nothing is as good as real fresh tissue. But what are we looking at, especially for what our purpose is? This is what we are looking at, and it is here we can really outline for you so you can see it. The superficial orbicularis oris, that's where we're going to inject very superficially, and the technique is to come. The deep orbicularis oris, and again, that's going to be the buccinator as it comes in. For that, we're going to leave that alone. We really want to make sure you understand that and that vermilion border, and let's go ahead and blow it up for you a little bit. And you can see right there. So where are we going to go ahead and inject? We are going to go ahead and inject right outside that vermilion border. And understanding now that these are other muscles that are making up the orbicularis oris, that's what we want, because again, I do not want you to have that complication of droopy lips or lips not working correctly. So that's going to be super, super important here. So now let's go ahead and talk about reconstitution and dosaging, because this is going to be important too. I'm not going to review all reconstitution and dosaging and reconstitution, especially if you know, you know. If you don't, then I'm sure you definitely get trained at an advanced level AFE course for the different dilutions that we can use. But the regular dilution of 2.5 ml to 1 is going to be to 100 units pretty much, is going to be exactly what we are going to go ahead and use here. So that is, I mean, that is the best dilution in our opinion for this. You can use a tight dilution. The problem is it's going to be very hard to actually inject it, because on any syringe, you're going to be injecting so little of the syringe, it's hard to know exactly how many units you're placing or how many micro units you're placing in any area there. And we like to use a 0.3 ml ComfortTox syringe so we can go ahead and see it better for that. Bevel up, bevel down does not matter here at all. Not when you're this superficial. I mean, if you like bevel up, go bevel up. If you don't, it really is inconsequential, especially when you're using a 31 gauge syringe. It's pretty much inconsequential for any of botulinum toxin delivery, bevel up or bevel down. But if you like bevel up, go for it. If you like bevel down, go for it. It doesn't really make a difference here when you're talking about it. It does make a little bit more of a difference when we're delivering filler through a ComfortTox syringe, but not for this. But you can see the units we're using here are 1.5 to never more than 3 for this technique here. For radial lip line, 3.5 units to 7 units, although 7 would really be pushing it, and that's when you get those complaints for radial lip line that they can't move their lips properly for that. But here, you generally are not going to have any kind of a problem with overdosing and then the patient, you know, having funny looking lips or not, or really, you know, the kind of lips where they just feel like, you know, they're half paralyzed and they gotta kind of keep moving them to work them out. The first few days, like anything, does feel a little strange to patients, but then it goes away very, very quickly. So you may want to go ahead and tell patients that, especially when you do it with filler, because again, then the whole thing just feels kind of weird for that. But this is one of the patients we're actually going to discuss here in just a second here. So we're talking about really just a little bit. So 2.5 ml regular dilution. If you go ahead and do that, pull up whatever you want. It's not going to be very much in that syringe. You then may want to add a little bit of saline. Again, go to a saline bottle, pull back a little bit more saline so that you can really see what you've got and then deliver it appropriately there for that. But you want to get in, give it, and we're going to show you the exact technique. So I don't want to get ahead of myself because we're going to make a big point of the exact technique as you're going to go ahead and see it here. Now, let's talk about the treatment sequence. If I want to do it the way I would like to do it, ideally, the best way is if the patient is patient, which is very few patients, really very few patients, but if the patient is patient enough, as you're going to see in the first case, we're going to go ahead and show you the technique in just a couple of minutes here. Then it's botulinum toxin first, wait a couple of weeks, see how much lip show you get, and then you go ahead and put dermal fillers and smooth PDO threads. I'd love to see how much lip show I actually get with botulinum toxin first, and then that may be enough for the whole thing. Or maybe they've had filler before and they just want a little bit more lip show without any more volume or projection or anything else. That's where this really, really great. Yes, we will definitely, you know, I know a lot of you are thinking already, what about patient fees for this? We're going to break it down for you at the end of this program in just a little bit here, so you'll be able to see that here too. But it can be a service all on its own, or it can be part of a greater service with filler, with smooth PDO threads. We're going to demonstrate the use of the microbotulinum toxin lip flip with all of those different things here. But this is my choice of that. But, you know, a lot of people are just not, we'll show you the other scenarios. A lot of people just are not that patient, right? They're really not that patient. I want to go ahead and show you just this before we get to the treatment video, which is going to come up next. And what I want to demonstrate here is how shallow we are, how superficial we are. Again, we're going to go ahead and really break down this technique because it's about precision and predictability. It's not just about squirting that botulinum toxin in there. It is really about precision here, but this gives you a really, really good idea how superficial we are. I do not want to be down into that deep orbicularis oris that's made up of the buccinator. I want to be really, really up on top, really close to that vermilion border, and as you can see. So let us get to this treatment video right now. Okay, Morgan is here. And Morgan, when are you getting married?
September 3rd.
September, so that puts it at about 3 months or so.
Yeah.
And she is here for a Botox lip flip. And I want to really break this down so that you will know what we are going to accomplish here right now here. Now, look at those lips. Those are pretty nice lips. We've cleaned them up really well. She is ready to go ahead and get injected here. But we want to go ahead and really pinpoint where we are going to put these micro Botox droplets nearly, because total, we're only giving her about 2 units all over this area here. So that's not very much. So first one is going to be in that Cupid's bow. We want to raise her Cupid's bow just a little bit. Now remember, the superficial muscle that we are injecting here is made up of the LLSAN, and that is what we're really injecting here, because the orbicularis oris muscle is made up of different muscles here. Superficial, made up from a lot of the muscles that go ahead and raise the lips, and the deep orbicularis oris is going to be made up of the buccinator here. So here, we want to go ahead and just inject that Cupid's bow right outside the vermilion border, and we want to go very, very superficial. So you see the angle that we are going at. We want to go ahead. This will pick up the Cupid's bow a little bit by taking out the action of, in this case, the attachment of the LLSAN as it goes into the orbicularis oris. That's the real muscle we're doing it, but we're doing it so superficially that the deeper muscle underneath will be able to push and give us more lip show without any filler here. So we're going to go ahead and give her a little injection right here. As you see, we freeze the frame a little bit. And then we go on to the next injection here, so you can really understand this here. Now, the beauty of this technique with the micro Botox lip flip as well is going to be the fact that you can go ahead and really pinpoint. You don't have to give this evenly wherever you want more lip show. And again, over here, we are going ahead and treating really what is the zygomaticus major and minor muscle as they come in to the orbicularis oris, because that makes up the superficial fibers of the orbicularis oris. Take out that action, and that's why you've got to be at such a sharp angle and also be so superficial. Then you go ahead and get that muscle underneath, the deep muscle of the orbicularis oris made up by the buccinator. Again, same concept, can go ahead and recruit, push, and it's not being resisted by the superficial layers at all, and that will go ahead and give her a little bit more lip show. These are subtle, but subtle enough that she can get a great result if that's all she wants for right now. That's why we always start with the microbotulinum toxin lip flip, and then we go ahead and add filler and PDO threads later on if we want here. Now let's take a look at the lower lip, because here, this is really the depressor of the depressor labii inferioris muscle that we're really injecting as it comes up into the orbicularis oris muscle here. And again, look how superficial, and it's a good idea to go superficial and also tent up. And if you can get a lot of that tenting, as you see right there, then you know that you are superficial enough. If you go deeper, then that's the way we go ahead and treat radial lip lines. And I think it's really important at this stage to know the reason that we're using only about 2 units on her, you don't want to use very much. You don't want to put any of these muscles completely to sleep to the point where she will have trouble going ahead and eating, talking, drinking, sucking through a straw, or anything else like that. And now we're just going to go ahead and finish that one. And now we're going to go to this one. This is the big one, and this is going to be the most medial fibers of the depressor labii inferioris on both sides as they come up and they form this superficial layer of the orbicularis oris muscle here. And you want to make sure that you get enough of both of these but this is the pout. This is the most important part of that lower lip. This is where they want the most lip show, in the middle third, just like this. You want to make sure you are really superficial. Again, tent up. Give a little bleb. You will actually see the bleb go in there and then cover both sides of that muscle as it comes up over the midline and forms that. You take that out, then that deeper muscle will be able to go ahead, push a little more. That rolls out this pout and gives you more lip show. And that's exactly what we want, whether it's filler for volume or whether it's botulinum toxin to take out the action of the superficial muscle. That's exactly what we want here. And now we will go ahead and just finish that. And you can see just a little bit of blanching, a little bit right there. And now we will go ahead. We can go to the upper. That's, again, the most important thing. You can be as specific as you want. And here's another important point that you're going to go ahead and see right here. As you see, as we come down to the oral commissure, many times that's where many lips go ahead and you lose that vermilion part of that lip. So this is really important. Now, I did not go on all of these. We did not necessarily go to all the way to the oral commissure. We are just placing it exactly where we want the lip show. And you can do this independently of filler or even have filler in mind if you are going to go back later. With her, we're just not sure. We may go back and add some filler later. And we'll just complete that injection, give a few more, because this side we want to roll out and get more vertical height and more lip show than we wanted on the other side. And that's true of the upper lip here and of the lower lip here as well here. So doesn't really take much to go ahead and do that. With this here, a little bit of water in the eyes because they can be pinchy, even with some topical anesthetic. She had some Comfortox BLT. Very, very light dabbing. Do not do a lot of pressure here. I want that micro botulinum toxin to stay exactly where we want it. That's exactly what we want to do. Tell them, don't touch your lips. She will be really happy with this result, as you're going to go ahead and see here. So now let's show you the before and after. This is before and this is after a microbotulinum toxin lip flip, as you can go ahead and see right there. And we got a really great result. And as many times happens, she says, you know what? I want just a little bit more. And then she's going to go ahead and go for some filler too. And again, we're prepping her for her wedding coming up. And we started about 8 weeks ahead of time so that we could see the result. There you have microbotulinum toxin lip flip. After that, and that's now the before, and that's the after with some beautiful filler here. So now she has the lips of her dream about a month before her wedding, which is perfect. That's exactly what you want when you're planning this out ahead of time. So if you like it the way we like it, we would love to do microbotulinum toxin lip flip first. Wait a couple of weeks, see what happens, and then go back and add some filler later on if we want. And PDO threads, they want those really crisp, sharp vermilion borders. So all of these things together can give your patients beautiful lips. So it's time to learn this and get AP certification trained today. Okay, you're going to see, I'm going to take questions in just a couple of minutes so you can keep asking questions. And I'm glad we do have a lot of questions there. That video, I said it early on. I'm sorry if, someone missed it or a couple of people might have missed it there. I said we freeze the action a little bit because if we don't freeze the action, it's such a fast procedure, you wouldn't get anything out of it. So we froze the action a little bit, and I hope that was helpful so you could see exactly where we were injecting, why we were injecting there, and what you saw on her is going to be different than what you're going to see on the next patient who's going to get a lot more injections for all of this. So keep asking questions. I'm going to come back and answer your questions in just a minute here so we can move on. But let's just review this again on her. Beautiful before and after. So let's go ahead and take a look. As you saw, again, this is before and after. This is just the effect of the lip flip, right? So just of the lip flip, as you can see before and after, that's more lip show. It's subtle, but it's certainly substantial in terms of what you need. Then she was kind of wondering, should I get more for my wedding? Should I not get more for my wedding? And then we went ahead and she wanted more for her wedding. But now this is before and now this is that before that you see is after the lip flip, and now it's lip flip plus filler. And she did not want these huge lips, as you can see, and that's her the whole from the beginning before to after the lip flip, only lip flip, and then after lip flip and filler all the way to the right, as you can go ahead and see there. That's really the way to do it. Here's a little bit more of a closer up, and now she is wedding ready. And again, when you are doing you're doing it for a wedding, give yourself plenty of time, or obviously any special occasion, give yourself a lot of time, to go ahead and get the results that you want. We usually say, at least 2 weeks before a major event, if it's the bride and it's the lips, I want to start about 2 months before to really get it exactly where I want to get it, with botulinum toxin, with smooth PDO threads, with filler there as well here. So that is what you're seeing on her, and great result. And she's, she promised we'll have to kind of track her down to get her wedding pictures, because we'd love to see those lips in the wedding dress there as well. I guess the rest of her comes with the wedding dress there too. But great results. She was super happy and really now ready to get married here. Let's go ahead and answer some questions. I'm putting this all in training questions. I'm not even going to answer. Go to afetraining.com. Congratulations to a few of you who have already grabbed some packages. So grab a package. It comes with a bunch of courses and all those bonuses on the bottom, and tuition does go up. So you save a lot just by the package pricing, but you're going to save even more when tuition goes up. And I forgot to mention before, save $500. Use that code for $500 off any package gold or higher. So now let's get to your questions. I think some of these questions are really going to be answered again, or are answered a little bit better in the upcoming cases that you're going to go ahead and see for this. Well, let me spend a few minutes answering some questions here, and then we are going to move on to PDO threads and lip flip, Botox lip flip, and then we are going to move on to when she gets filler first, and then do a Botox lip flip. We're just going to show you the Botox lip flip after filler, but really talk about all of that here. Some great questions here, so I'll try to take some now, and whatever's relevant, and the rest we will hold off till later. We're going to talk about patient fees there too. First injection does not have to be in the Cupid's bow. It can be anywhere, and again, needle tip is right outside. You're never injecting in the vermilion port. You are right outside in the cutaneous, in the skin, in the muscle, right underneath the skin here. But that doesn't have to be the first injection, and that goes to another point a whole bunch of you have asked about. Yes, I said exactly that. That's the nice thing about this. Radial lip lines, generally, you want to treat the entire muscle all the way around, because then you treat it as one muscle. Not here. I literally can go ahead, and if I need more lip show, as the lip goes to the corner of the mouth, the oral commissure, I just inject that. If I just want the lower pout, I just inject that. That is, that's how specific this treatment is for that. So I do not have to go ahead and inject the entire lip. That's not my purpose here. Now, with this patient and the next patient, I think we inject most of the lip because they want an overall lip flip. But you can really, really tweak this, especially if they come back for an enhancement for all of that. A lot of questions about how much saline to add. This is really up to you. We determine we want 1.5 units, 2 units, whatever it is. We pull that into the syringe, but then many times, that's not a lot of fluid. It's really hard to go ahead and deliver. So then we will go ahead and pull up a little bit more saline, and instead of diluting this before reconstituting it before 4-to-1, 5-to-1, 3-to-1, whatever those numbers are, I don't want to have to dilute the whole bottle. I can literally just pull up some extra saline, just a little bit, and that could be 0.5, just enough so I can see how much am I going to distribute in each one, because you don't want to get it where it's so micro that you can't even see on the syringe what you're doing. So the formula is really up to you. I don't want too much. I would say generally we're talking about pulling up, 0.05, 0.1, 0.2 at the most. But that's probably not going to happen most of the time. So 0.05, 0.1 additional saline, so that we can just go ahead. If I've got 6 marks, then I can just do a 1/6 in each, of that in each one, and then figure out how many hashtags just by looking at the syringe for that. So it's just a matter of really negotiating that syringe with the saline there. There's no magic number, because remember, and I think this still confuses a lot of people there, if I pull up 2 units, no matter how much saline I then pull up afterwards, right, straight from a bacteriostatic saline bottle, I pull up another, it doesn't matter how much volume, there's still only 2 units in there. You got that? If you didn't get that, I will say it one more time. If I pull up 2 units, no matter how much saline, big or small, if I pull up 0.05, 0.1, no matter what I pull up in terms of saline, there are still only 2 units. It's now just diluted more, right? I mean, that's all it means. So it's just a matter to make it a little bit easier. Why not anesthetize dentally first? You certainly can, for sure. But most of the times, again, you saw a procedure where I froze the frame on purpose in a number of places so that otherwise the video would be about a minute and a half. Most people do not want to get numb for a minute and a half procedure. They'd rather go through it. By the way, after I do filler, they're mostly anesthetized anyway. Can still be a little pinchy from the lidocaine and the filler. So that happens a lot there too here. Can you also inject Botox for a paper nose and gummy smile at the same time? Absolutely. We do that all the time. Let me just go ahead and let's take a look. No, she did not have any filler to lift her cheeks. That was, the rest of her was all natural there. Okay, so let's go ahead and do that. How many total units in her lips? I think we said about 1.5 or 2 units for that. How many units in each injection? However many injections divided by 2 units. That's how many were in her. I think we did 6, 7, 8 injections. So whatever that is, just divide it, and that's going to be it. Let's take a look. Okay, how much? Okay, how many total ml? It was in the syringe. I don't know. We have to go back and take a look at that video for that. But again, it's not, the total ml is irrelevant. It's how many units are in that syringe for that. How long does it last? It'll last a good 3-4 months for all this. Dysport will not give a longer effect. They will all go ahead and do the same. Another one that I won't mention will definitely give a lesser effect. That's for sure. That's for sure for all of that. Let's take a look. Yes, so we are diluting it further by just going to a saline syringe and just pulling it up right into that same syringe. Okay, we answered that. Actual measurement above the vermilion border. I mean, we're within 5 millimeters, 6 millimeters, not any further than that. That's for sure. For that. And this is a TB injection. It's exactly right. It's very superficial. You should almost see the bleb there, depending on how much solution you're putting in. No, I mean, if I want more if I want more lip height, yes, in any one of these injections, I can give just a tiny bit more botulinum toxin, but don't overdo it for all of that. The dilution in Morgan's case was 2.5 ml to 100 units. I mean, that's the standard, and I tell you, we use that 80% of the time for sure. Tight dilutions we use in a lot of other places that we'll leave for another time. Let's go. Yeah, I mean, we're just answering questions right now. So that's it. Not 2 units per upper and lower. 2 units total over the entire lip flip. So that is that. Okay. Let's take a look. Yeah, we're still on that. We haven't advanced any slides. I'm still answering questions here. Can you inject deep smoker's lines of lip flip on the same day? That is a great question, Tracy. That is really a great question. So the answer is technically yes, but sometimes it can be a little complicated. I would much rather do a lip flip first and then see how much I get from a lip flip without anything else. Because, once you start messing with both, you're not going to get that. I mean, again, think about what I want here. I want that lip flip because that is making recruiting the deeper bicularis oris muscle to push out that lip flip. That's what I want to do. So typically we're not going to do radial lip lines at the same time. You've got to kind of have to choose. If I go ahead and do radial lip lines, then typically I'm not going to do a lip flip with botulinum toxin. I'm just going to rely on filler most of the time here. So that's it. We use ComfortDoc syringes for all of our injections. It is the best. Patients absolutely love it. All right, I'll answer more questions as we get a little bit later on. So now we're moving ahead. All right. So now you should you're going to see these slides move here. But that was great questions, a lot of questions. I'll come back and answer more questions a little bit later on here. Now let's talk about lip flip with PDO threads here. And what are we going to do with those two together? And we're going to show you a quicker video on that. But then we're going to show you, again, a more involved video and really break down the Botox lip flip again here. But what do we want with this? What we really want is sharper lip borders and picking up and holding that vertical height at the same time that we are doing a lip flip with botulinum toxin here. So smooth PDO threads, learn them. They are fantastic. We're going to limit the discussion here just to putting them into the vermilion border, which you're going to go ahead and see. Why do we love, and that's why they're called solid filler smooth PDO threads. We love them because imagine you had a stiff piece of filler that you could put anywhere, and that anywhere in this case is going to be the vermilion border, and that's what we're going to do. And that really solidifies, gives you crisp, sharp vermilion borders, but it really holds up that vertical height there as well. And as they break down, they produce collagen, which is a great thing to have in a vermilion border, that's for sure. Again, there's so many uses for smooth PDO threads. Again, we're going to really limit the discussion. I just wanted to show you a combo case for here. But there is no way you are doing total facial aesthetics without botulinum toxins, dermal fillers, lifting PDO threads, which is beyond the scope of this, but smooth PDO threads as well. Smooth PDO threads we use in so many different places. It's amazing there for sure. Make sure, again, I cover this in other lectures here, but make sure you use only the top line, FDA cleared class 2 with known origin and proper packaging. I wouldn't touch anything else. There is no such thing as an FDA approved PDO thread. That's a different category, that FDA approval for class 3 medical devices and for pharmaceuticals like Botox. That is not what PDO threads are. They are classified as a class 2, but they need FDA clearance class 2 PDO threads. And the V-Soft Lift is our choice. Why? It produces the most collagen. It's the first FDA cleared in the cannula, the thread and the cannula as one device. And that's just kind of a nerd out thing, but super important if you ever have a patient complaint or anything else like that. So it's the only one in that top category that goes ahead and has both those things. But for us, we have that, and it produces the most collagen because it has a very special polymer coating that breaks down slower. That means more collagen production. Personally, we do not advise anything else that's on here for different reasons here. We've got our standards, FDA standards. For that FDA registered, you should stay as far away from as possible. I also want to know the origin of it. People do get fined for using non-FDA cleared class 2 with known origin and proper packaging. So again, we'll leave that for another time. And plus the fact, if yours ever comes in a blank package like that with a little sticker, you should run away from that. It's your license at risk. So we'll keep that for another time. But I do want to show you this because you should be adding smooth PDO threads to your practice for sure here. So let's show you a combination case of this. Now, how we're going to put this in is super important as well, as you're going to see in this treatment video. And this one, we're going to go straight through. We're not going to freeze any frames, so you'll see it straight through. But then in the next video, we will go ahead and again, be really precise, and so you can see exactly what we're doing here. Always smooth PDO threads in the vermilion border first. You'll never get better vermilion borders, sharper, crisper, clearer. You can't do it with filler than smooth PDO threads, but you want to put the PDO thread in first, then the botulinum toxin afterwards. Why? Because think about it, if you put the botulinum toxin in first, then the smooth PDO threads, that smooth PDO thread will take that botulinum toxin for a ride into different parts of the muscle that you may not want. So you'll understand it more in this short video. So let's go ahead and show you that right now. And what we are doing here is we are just going to accentuate the vermilion border. And that's what Megan is doing. She's going to put a solid filler PDO thread, a smooth PDO thread from a new bio. And that is going to go along here and really pop out this border here. She can do that on the upper lip and the lower lip. And then we are actually going to go ahead and add some micro Botox there to get some more, some more vermilion show. So the combination of the two treatments would come out really well for her and really do really well for her. So that's doing great. How you doing there, Lindsay?
Good.
Good. So far, so good. So she has had some ComfortDocs BLT-like material on her lips and sitting there. How long was it on there? Probably 15, 20 minutes or so, something along those lines here. And that is looking good. Hang on there, Lindsay. You're doing really well. That is good. Just follow along that vermilion border. You're doing just great. These are 31 by 30, so this will give a little bit of more of a subtle roll and also a subtle vermilion border there. That's good. That is looking good. And if you need to come around to the other side. Okay, how's it going, Lindsay? Good? Okay, super. She's a super patient here. So that is looking really good. Vermilion border pop out, and that's what this is all about. This is about popping out the vermilion border. She had dermal fillers, I think you said in January or not too long ago, right? So her lips are pretty well filled to exactly where she wants them. And, but she really needs some definition in this, in the vermilion border here. And that's what we are concentrating on. So between this and in the vermilion border, and then we're going to give her some micro Botox to go ahead and do a lip flip. That is going to give us more vermilion show, and then the combination of the filler in there and what we're doing now is really going to be very significant for her. So we're going to do a couple more. Those are their 31 by 30. Now what she is going to use is going to be I'm going to kind of show this, a little mini thread. And this little mini thread is going to go ahead and finish off that Cupid's bow by going right in there. So let me just show you exactly where we want this to go. Yep, right in there. Just start at the top of the Cupid's bow. This is going to go right into that vermilion border. Perfect. Slide that right in. Make sure it's past the thread. That's good. Okay, and you can leave that. And then we're going to do one more. You want to come around on this side? How you doing, Lindsay? You're doing fantastic. And it's got you really important. What's super important here is the treatment that we're doing and the sequence of treatment here. We are doing threads first, and we are going to do micro Botox right afterwards. And the reason that we're doing threads first and then micro Botox is we don't want to do micro Botox first and then threads, because that could then deliver the Botox to areas that we really don't want to deliver to. So that is great. Twist and remove. And she is doing just great. Fantastic. She's been using the ComfortDocs Vibe. She went between ComfortDocs BLT, ComfortDocs Vibe, and the technique. That looks great. Now just take a look at what we've done. Look at this beautiful vermilion border now. It's got much more definition, much more of a white roll. That is looking great. So let's go. Are you ready to go straight to the micro Botox? Let's go straight to the micro Botox. How are you doing, Lindsay?
Good.
Yeah, you're doing really fantastic. So micro Botox, this is a highly diluted botulinum toxin concentration. And this is going to be a very superficial delivery of this. And it's going to take, a few little pokes here to go ahead and do that. I guess
Sorry,
pokes.
little pinchy.
Yep. Sorry, pokes is not exactly a scientific term, but a few little injections. We're going very superficial. The whole point here is to get us very superficial fibers of the orbicularis oris to quiet down, and those deeper muscle fibers of the orbicularis oris will go ahead and push out and literally flip out that vermilion border to give her much more vermilion show. And it's going to look fantastic. I mean, already, and the nice thing is about her, you can come around here. There we go. Go ahead. The nice thing about her is she already looks fantastic. So we're going to make her look even more fantastic by just getting that little more vermilion show, which is really going to be really outstanding. I mean, it's really great. And it's so great to do with or without fillers in the lips, depending on the patient. You really need training. You need AFE training for all of this. That goes without saying, to get the best lip results and the best facial aesthetic results all the way around here. So that's looking just great. Lindsay, you are a fantastic patient. And we just gave Lindsay some Botox in her masseter temporalis, forehead, glabellars, crow's feet. in all those areas there as well here. And a little brow lift too. So she's had a lot of treatment today in a short period of time. How you doing, Lynn?
Good.
Okay, great. She did just great. And we'll get her back and we'll see what she looks like when we're all done. All righty. So now you can see before and afters. I mean, we could show you lots of them, but I'll tell you, great looking lips, full lips, so you can make them any way you want. It is about microbotulinum toxin, lip flip, fillers, PDO threads, smooth PDO threads. For that, we can just show you, I mean, thousands of before and afters literally for that. But here's Botox lip flip, no filler, a little bit of PDO threads. It is really great what we can go ahead and accomplish for that. What do we charge for this? And we'll talk about what we charge for Botox, micro Botox lip flip a little bit later on for this. This takes 5 VSoft lift smooth PDO threads. Your cost is $25. The patient fee as an independent procedure just for those crisp, smooth lines is anywhere from $350 to $500. Treatment literally takes minutes. One treatment, the results will last 12 to 18 months as an individual procedure. Now we package it with micro Botox lip flip and with fillers. We'll talk about that a little bit later on. You can package it really with whatever you want. And then full smooth threads treatment, which we're not going to show you, but you can see this cheek was all built up just with our own collagen, 3 sessions and about 20 threads on each side. Another reason we use VSoft, it's the least amount of threads for the maximum amount of collagen biostimulation. And this is about 3 treatments, about 4 to 6 weeks apart, and she paid $750 for each treatment. So this thing pays for itself. Smooth PDO threads has among of the highest ROI and one of the easiest injectables to learn and do. So definitely go ahead and learn it. I mean, that's for sure. I mean, you should be learning it for sure. And the AFI has the only live virtual CME certification training on smooth PDO threads. That includes a live virtual Zoom session, a full AFI on-demand certification training. This is an 8-hour CME virtual training course for smooth PDO threads. If you have experience with Botox and fillers, then you can learn smooth PDO threads. It's about the right plane. This also includes a box of smooth PDO threads. For all of that, you can see the upcoming sessions right there. The last session, which was we have them at least once a month. I mean, sold out, so you can't even get to that one already. And you can save $500 for 24 hours. AFI members save even a little bit more for all of this. These threads completely dissolve over time, but they leave collagen, the body's own natural collagen that it builds up, and that lasts as long as collagen will go ahead and last. I mean, that's for sure here. So let's move on. We got more to cover here because I do want to show you one more case, the real precision and real close up so you can really understand it here. But it's about the lip journey. You can go from small lips to great lips to big lips to full lips. It's really whatever the patient wants. This patient has had all of it. I mean, they have had all of it when it comes to lips, but also cheeks and botulinum toxin and everything else that you can imagine. Let's talk about same appointment, treatment sequence. This is the way a lot of people want. They want the dermal filler right there. They want smooth PDO threads. They want microbotulinum toxin lip flip all together at one appointment. Again, if I had my druthers, it's not ideal for me, but you gotta give people what they want for all of this because we can make it work. That's for sure. We can definitely go ahead and make it work. And this one, you're going to see this patient is going to be about filler first and then microbotulinum toxin lip flip, as you're going to see. And she's a different patient, so it's not about that same thing. It's not about that radial lip line where there's pretty much a defined, for most patients, way to give it. This is very specific. I can only do half of a lip if I need to, because the other half has a lot of lip show, because as you know, many times lips are naturally asymmetrical, and if we're only talking about a lip show, I mean, so that is really important here. But we're going to do the same thing. I'm going to go ahead and freeze the frame at certain points so you can really see what we're doing, because otherwise this whole video would be a minute and a half long and you wouldn't get a whole lot out of it here. So let's go ahead and roll this video right now for you. Microbotulinum toxin lip flip coming up. We're going to mark this very carefully, exactly where we want to put this. Now, this patient has had some filler, doesn't want any more filler because she doesn't want that, again, that bloated filler look. She just needs a little bit more, and this is where the microbotulinum toxin lip flip is going to be just perfect. So we're going to mark this very carefully. She's been cleaned up, and she has had some Comfortox BLT topical anesthetic, and we're going to stop the action. Show you, we're going to be right outside the vermilion border, very superficial as we go in. Let's stop it so you can take a look and see what we're doing. Almost going to tent this up so we know that we are very superficial. Now, again, what are we injecting here? We are injecting as these other muscles come into the lip, that's what creates a superficial layer, zygomaticus major, minor, levator labii superioris, then the levator labii superioris aliquid nasi, as we go one right after the other here. The beautiful thing about the microbotulinum toxin lip flip is I can put it, I don't have to do this as sequentially for this. I can go ahead and pick any part of the lip where I want a little bit more lip show, and it doesn't have to be the whole lip. In this case, she's had this beautiful filler in her lips there. She just wants a little bit more, and as you're going to see, with the filler in there, nose, lips, chin, perfectly straight line. That looks really good. So she just wants a little bit more lip show. And so we're going to add the microbotulinum toxin lip flip so you can see as we go ahead and inject each one of those very superficial muscles. Look how superficial. The point of this is take out the action of the superficial muscle, and then that deep muscle, the orbicularis oris, which is really made up of the buccinator, can then push a little bit more. That flips up the lip and gives us more lip show without adding any filler. And again, we do this many times before filler, and then many times we do it after filler, just like this. These lips have settled in a little bit. We've given them a little bit of a shine to kind of protect them while we do this microbotulinum toxin lip flip, as you can see right there. We can do it immediately after a filler injection. We can give it 2 weeks later. We certainly like to give it before, see how much we get, and then go ahead and give the filler there as well. And then smooth PO threads for those vermilion borders, so you can see we're doing exactly the same thing on the other side. Hers is just all roundabout. That's, we want a little bit more lip show everywhere on her. So now on the lower, what we're going to do right here is we're going to go ahead and do that lower lip. Lower lip is a little bit different. Remember, we are involving the depressor labii superioris muscle as it comes into, that's the superficial part of the orbicularis oris here. So that's what we're doing here. You don't want to go any further down. You want to go right there. If you go further down onto the middle of between the lip and the chin, then you are going to actually go ahead and affect their smile. So this is very precise. You want to be right outside the vermilion border, and that's why we stopped it, to make sure that you really get exactly where we are injecting this. If you're just a few millimeters inferior to this point right here, you could certainly have some trouble where the patient smiled. You would not show all of her lower lip, and it would look like she had kind of like a stroke or something like that. And that happens many times with a Mentalis injection that has gone wrong. So we want to make sure we are exactly where we are going to be here. So superficial, you can see the blebs, you can see the tenting, and this is the important one. And this is really crucial. And this is that middle pout here. And imagine that the depressor labii inferioris, these medial fibers are coming up on both sides. So you want to make sure that you're in the midline. You're going to infect both sides of the depressor labii inferioris muscle, because that's the superficial part of the orbicularis oris. And again, you want to be right there. And this will roll out that pout beautifully. The deeper muscle of the orbicularis oris, made up of the buccinator, will push a little bit stronger because it's not being held back by those superficial fibers. Roll out that pout. More lip show is exactly where you want it. The pout is everything when it comes to the lower lip, as you can go ahead and see right there. So that is going to be a beautiful example of what you want to do. How much are we putting there? Little bits, little droplets of microbotulinum toxin here. Again, if this entire lip is about 2 units, so imagine that we've spread about 2.5 units all through these injections here. So we want to make sure that she does not have lips that she's got to kind of work out in the morning to get them going, and that they haven't been affected by too much microbotulinum toxin here. That happens a lot in radial lip line treatment. And now, same thing on this one. This is also a crucial one as you go to the side there. And again, the pressure labii inferioris, and that's where exactly we want to be. That's how shallow we want to be. We want to see that bleb right there when we inject it, just like we've seen the others, and all of them together. Now, I can go further down to the oral commissure. She really doesn't need it in the lower lip. She needed it in the upper lip, but she really doesn't need it in the lower lip at all here. So now we'll finish this injection here, keep it superficial, and she is pretty much done with that. Now, she has had other botulinum toxins, so we're going to get her cleaned up, but here is something so crucial. A little bit of dab will do you. That's it. Just dab it a little bit. Don't be squeezing it. Don't be molding it. Don't be doing anything else like that. If you've just done filler, you want to do all your smoothing and Comfortox lips to settle the lips down before you give this microbotulinum toxin, if you're giving it at a lip filler appointment, like we've done here, exactly what we've done here as well. So that is really important to make sure that you understand that that's what we want to do. Same thing with everything else. We're going to clean her up with all the other botulinum toxin that we have done here and get her nice and clean. We're not putting pressure on. Don't move that botulinum toxin no matter where you gave it. We certainly give the patient those really important instructions of don't touch your face. We do not want her to move. And this is crucial with microbotulinum toxin around the lips, that lip flip. If they start squeezing their lips and it goes, like I said, a little further down on that depressor labii inferioris, you could have a problem with her smile just like that. And this is what I wanted to show you that we mentioned before, and we're going to show you the lips, the nose, the chin. That's facial profiling that looks just beautiful, and facial balancing, as it's called, a number of different things. So this is exactly why we don't want to add any more filler in this case, because she's about where she really should be. The upper lip a little bit behind this rickets line here, but that is just beautiful here. So now let's go ahead and show you, because she has had before and afters. This is a before and after coming up of just before and then after with filler without a botulinum toxin lip flip, and she liked it, but she did want a little bit more here. And then time went on, and then we went ahead and did, here's the before again, but before and after with filler and a microbotulinum toxin lip flip, because we didn't want to add any more filler because she had a great facial balancing as it was. That's where you use microbotulinum toxin lip flip. It can do a fabulous job for you. You've got to make sure you learn this and all of this together. It's really about putting all of this together. So it's time for you to get AP certification trained today. All right, so I'm going to answer questions a little bit because I want to just review this case, and then we are going to talk about patient fees, and then I will stick around, answer all the questions that you have here. So here we go. All right, so here she is again, before and after with filler. And again, she's had filler before, it just didn't do enough. She didn't want giant lips by just adding more and more filler with all this. So this is before and after filler without a lip flip. And then you go ahead and then you have before to filler plus a lip flip. And that gives her enough without giving her all that extra projection as a lot of patients just don't want the way overblown lips, but they still want more lip show. How can you do that? Absolutely. Go ahead and add microbotulinum toxin lip flip to your repertoire. But it's only predictable if you really understand the anatomy and you really follow along what we've been talking about. And here you can see the sequence with her there as well. And by the way, and we talk about this all the time, how old do you think this patient is, right? How old do you think this patient is? She is 23 years old. Patients are starting younger and younger and younger, and we talk about this literally all the time for that. This is the first generation, this Gen Z generation, the first generation that goes ahead and considers lip filler, botulinum toxin, smooth PDO threads as self-care. It's like getting their hair and nails done, and I've done We've done in many of our programs, we certainly talk about that quite a bit here. One of your big questions is, what do we charge for botulinum toxin microbotox lip flip? For microbotulinum toxin lip flip, I guess, for this. So let's talk about this from a couple of angles here. Number one, as an individual treatment by itself, we will charge anywhere from $250 to $350 by a standalone treatment. They want more lip show. That's what we're going to charge. You do not charge by the unit. This is not a commodity when you're doing an advanced precision procedure. Don't charge. If you charge like you're a commodity, you are a commodity, and they just may as well go somewhere else. So it's about the result. It's not about the units that you're using there. I mean, that is exactly what we're talking about. You can certainly charge by the units. They'll pay you $30 and $40 or whatever you can get out of them for that. Definitely not worth it. I mean, definitely not worth it for you. You've got to really elevate this, that this is an advanced procedure for what you're trying to deliver. And by the way, I mean, I am a big proponent, especially in this day and age. If you want to stand out, well, then let people know that you're advanced, you have more training, you get better results. That's exactly what they'll pay for. And if they're shopping, let them go shopping, because if you get that, I mean, again, it really depends on you and what you want. I mean, I talk about patient fees all the time with AAFE members, and we present on this all the time. If you want to be that kind of a factory, get them in, get them out, charge by the unit. You could never go ahead, if you are going to go ahead and try. There's a race to the bottom in terms of price. You'll never win that race. You never will. People will use fake Botox, cheap Botox, stuff that they'll get from overseas, and $4 bucks a unit. You can't compete with that. There's just no way. What you can compete in really is really delivering the best results possible. So by itself, just like we talked about before, smooth PDO threads for the vermilion border by itself, also like $350, somewhere that area if it's an independent procedure. If this is an independent procedure, we charge by the treatment, not by the units there. And then if it's comprehensive, because we're doing fillers and we're doing this and we're doing PDO threads, I mean, full lips with all injectables can be $1,100, $1,500. It can be whatever you want it to be. And I understand that may make many of you nervous for that. And all I would tell you is one thing here. Try it. Just try it. If you've got to be confident. You've got to be well trained. Now, I can tell you this I know from training thousands of healthcare professionals, dentists, physicians, nurses, nurse practitioners, and PAs every single year in the AAFE. If the better trained you are, the more confident you are, that comes out right to your patient in consultation, and they get the feeling you know what you're doing and you're worth the money. Then you present the fee. And the first time you will be nervous and think, who's going to pay $1,100, $1,500 for lips for comprehensive treatment? Try it. And you get a couple of no's, that's okay. But the first yes that you get when you present a comprehensive fee and the patient goes for it, you will never go back to charging by the syringe for lips again, by charging by the units for Botox again for that. I mean, I know you'll be nervous the first time. I've helped many people through it over the years. All AAFE faculty have helped people through it over the years, but people will pay for great results. What will usually happen is, you do a micro Botox lip flip, you use 2 units, you charge them, boy, you think you're really charging them a lot. You charge them 30, 40, 50 bucks for it. They don't like it and they hate you over 50 bucks. Like, the whole thing's not even worth it. You can deliver precision, predictable. That is what it's all about for that, and you will be worth it. But again, I know that many of you are AAFE members. I know how well trained you are. You've got to feel confident in producing those kinds of great results. So definitely try out some of these procedures, and I think you are going to absolutely love it. I know who will love it. Your patients will love it. Your patients will absolutely love the microbotulinum toxin lip flip for giving them a little bit more lip show without filler, without projection or anything else. Combine it with smooth PO threads, combine it with everything else, and it will be just amazing for you. let me go ahead and answer questions in just a minute. But those of you who want to go see again, follow us on Instagram, Facebook, YouTube, and TikTok. Here's all of our live patient training. So much live patient CME training. Take CME training. I just got a call from a licensing board yesterday, and they wanted to discuss a case that came to them. And guess what? The first question they have, CME training, and now they did some kind of lousy training with somebody they met on Instagram. Not knocking that, a lot of great trainers on Instagram, but if it's not CME, it means nothing to a licensing board. And this happened to be a nursing licensing board for that. Nothing to them. So we've got all kinds of advanced courses: master lip size, nose, cadaver lab, ultrasound training, advanced level Botox and fillers, and all those different things. And here is the training. Again, I'm still getting training questions for that. Let me just take a look about training questions, and then I'm going to answer all these questions that are coming in. I'll leave this up for a little bit, and then I'll put up that resource slide again in just a minute here. Your membership package, Teresa. Yes, you bring your own models with you to these hands-on training. That's usually the best learning experience. And I mean, you can find one at the course, but really the best learning experience is definitely going to be when you go ahead and do that. I'm going to put my webcam on for those of you who it interferes with a lot of the video sometimes. So I generally don't share the webcam, but now I can. Let me see if I can get it to work for that, and then we'll see. Okay, there we go. Hi, everybody. Great to have you here. Having a little bit of a crazy hair day, so that's okay. But you can see me. I can't see you for that. But let me answer a bunch of questions. There are some great questions that we've got here. For those of you, I mean, 99% are hanging on for the hundreds of you that are on there. All right, that's where we ended off. So yes, threads completely dissolved for that. How much do we charge? We definitely got that. And it's the great question, Karen. I'm not exactly sure what you're talking about. A micro Botox lip flip is replacing a traditional lip flip because it's going to be a lot more precise. I mean, we don't do a traditional lip flip of just putting it in certain areas for that. Best liner, a lip liner pencil to buy? I have no idea. That is a question for someone that's way above my pay grade for all of that. Does Jeuveau work as well as Botox for a lip flip? Really depends on who you ask for that. If you get really good results with Jeuveau, God bless you. I know it's a trickier toxin to get to work. Just ask them. I mean, we've had them come to our office a number of times here for that. Definitely a little bit tricky. It wouldn't be my first choice. I would go to Xeomin or Botox actually for all of that here. Let's take a look. Yeah, I think 2 units for a top lip and 2 units for a bottom lip for a lip flip is way too much. That's when you get them going like they can't move their lips very well or anything else like that for that. Hi, Michael. Great to have you here. I really appreciate it. Definitely try this technique. He's got one scheduled this week. Go for it. That would be great. So comprehensive care is what I'm talking about. And the question is, great question here, Teresa. Do I mean all the treatments in one sitting, or is it planned over time? It can be either way. I give them, you want great looking lips. Ideally, for me, I would love them to do botulinum toxin first. Wait a couple of weeks. I'll give them one fee. It'll cover 2 or 3 appointments for that, but I just give them one fee here. But generally, I could do them all in one sitting without a problem. What's the sequence? It is filler first, then smooth PDO threads, then botulinum toxin lip flip. Why? Because with our filler techniques, if you've seen some of our other programs, and we've done a number of other programs here on lip fillers, precision lip fillers, and all kinds of different techniques for all of them. We have a master lips course, but we do a lot in terms of smoothing lips after fillers. That is the key to a great lip enhancement. Not only placement precisely, not only knowing the anatomy and safety, it is about really smoothing that filler right into the entire area there. So I move things around a lot when it comes to the filler. Then I add smooth PDO threads in those vermilion borders, clean, sharp, crisp vermilion borders, amazing. That. Then botulinum toxin lip flip, the micro Botox lip flip for that, because that's the last thing. I don't want to move it around at that point. If I do that first, in the same sitting, then everything's getting moved around, and that's where you really have trouble. But I could do it in the same sitting. It really depends. Patient, how much of a hurry they're in, and usually they're in a hurry, as most of you know, for that. But you definitely want the AFE lip technique that we teach all the time, and we do virtual trainings just like this one on that. I think we did one a few weeks ago, but I'm sure we'll do it again in the next couple of months, of the no swelling, no downtime technique. People want to go ahead and show their lips immediately. You go get a new anything, right? You want to show it immediately. Same is true of lips there as well here. Let's take a look. For that. No, absolutely, Comfort Talks. You've got to learn the different dilutions. We don't use. Allison, you mentioned another brand of a syringe. We absolutely do not use that syringe. First of all, if you compare that to Comfort Talks and see how easily Comfort Talks glides in, you want to be known as the most comfortable injector. The one you mentioned, and definitely a few others, you can feel how ragged it is when you give the injection. It's night and day difference, and your patient feels it. If you're the most comfortable injector, your patients will flock to you, because there's a lot of sloppiness that is really out there for all of that here. Let me take a look at this. Kevin's question: the patient pays $1,100, $1,500 tomorrow. Would you plan for them to reassess in another 6 months? And then do you think they would need to do all 3 injectables again? We will see in 6 months. I mean, really it just depends for all of that. That's a patient's first question. The patient's first question is, I want the best lips possible. How am I going to get the best lips possible? This is what you need. This is the fee. Can we just do filler? Yes. And then I've set the expectation. You can get this. If you only want this, that's okay. That can be a lesser fee for all of that. And then later they may go for the whole thing. It's about planting seeds in somebody's mind. Then when they come in 6 months later, we reassess and we go ahead and see. They may have really nice vermilion borders already left over. The collagen production from smooth PDO threads will last a couple of years. So I may not have to do that in again. So yes, it could be a lesser fee over time, but I wouldn't promise him what's going to happen in 6 months. We'll see in 6 months. Remember, people change in 6 months there as well. Their metabolism changes, their activity changes. And I mean, I could talk a lot about that, but we'll kind of keep that for another time here. Let's go ahead and keep answering a few more questions for those of you. And again, most of you are sticking around. Let's take a look. Oh, what we were looking at is facial balancing. Remember, we kind of took that pen and we went, I'm not a good example of facial balancing, and you're not going to see it that well anyway. When we did that, lips, nose, lips, chin should be properly balanced, and that's a whole that's a, level 3 AFE course and a lot of different things. If you just give them lips and that lips is out there, but the nose and chin don't line up, you've got these overblown lips that look ridiculous. So many times the chin needs filler, and that will bring it out. For facial balancing is what it's called, a little bit more advanced for sure, but you should definitely get there. Start off with a level 1 botulinum toxin filler, and then level 2, and really build up your skills. But facial balancing is really what it's all about when you get to it for that. Let's take a look. Today I was shown a no needle injection to filler to the lip. Have you seen this? Yes, run as far away from it as you can. We have tried so many of those devices over the course of 15 years, and they are awful. I mean, just awful. None of them are FDA cleared for anything. You should run as far as you can from that, because that's how practitioners get into a lot of trouble. We've looked at all technologies, blowing it with air, blowing it with other devices in there through one hole, fill up a whole lip, you name it, we've seen it. It's really insane to go ahead and do that. Priscilla, that's a great question, and that's a question that you can email the AFE info at facialesthetics.org, as you can see right there. But generally, you need a license, a medical dental nursing license, in order to be able to be licensed to inject in the U.S. For sure. There, let's take a look. The smooth PDO threads can be as many smooth PDO threads as you need, depending on the lip. Long lips, then many times we will use 7. For the most part, 5 would be what we want. There are also mini PDO threads, or a lot of different things for that. You should definitely get trained, Christina, on Star Wars smooth lifting PDO threads. They're amazing, literally amazing. but we use as many PDO threads as we need for whatever the treatment is going to be. And many times when it comes to lips, it can be 5, it can be 7, sometimes it's only 3, depending again on what we want to raise or what we want to go ahead and do for all of that here. Again, it really depends on what you're trying to do. 1 unit for the upper lip, 1 unit for the lower lip, that can work for that. But again, sometimes I'm only doing the upper lip. That's the beauty of this technique. And yes, you heard it right. A few of you were asking before. Yes, you definitely heard it right. It is about literally being really specific, because you may have really good lip show on one side of the lip. You need it on this side, only do a micro Botox lip flip on the one side for all of that. That is really good. Okay, I think we have that. Why do you get puckering sometimes with smooth PDO threads? You're in the wrong plane, and that can happen to anybody, even if you're a veteran doing that. So that's usually why you get puckering, dimpling with smooth PDO threads or lifting PDO threads. So it's really about getting into the right plane. Trisha, chin filler, which filler? That's you can email the AFE, info at Facial Aesthetics, find out what courses that is in. For that, I mean, occasionally we do have we've got cadaver courses there, CME training on virtual, so that may be coming up next month for all of that. In-person training, all CME training for all of that. Let's take a look. Okay, if you put Botox first, how much do you put and how deep? We were taught 7 units for upper lip, 3 lower lip. Delia, that is only talking about radial lip lines, not talking about this technique. This technique will not take that much for sure. That's deeper radial lip lines for that. Let's take a look. Yeah, so that's great. Great question, Todd. So Todd has a great question. PDO threads for that. What if you want that medial corner of the Cupid's bow, which is really short? You saw us come with smooth PDO threads along the lip vermilion border, the long part of it. Well, what about that medial part of the Cupid's bow? So V-Soft Lift is the only company to have a mini PDO thread just for that. And I didn't show it in this case, but we use it all the time. It is fabulous. It's also fabulous for individual scars and that kind of thing. So thank you for the question there as well. That's it, folks. I really hope that this was really good for you. I just took the time to answer questions, and most of you stayed on. So I really do appreciate that as well. If you have any questions, Dr. Lewis at facialaesthetics.org, as you see, all the different websites that you see right there, afetraining.com, for the best tuition deals always. But really grab one of these packages, as you saw, AFE Virtual, Smooth PDO Thread Training, and lots of other things, as we saw right there. So thanks for being on this. We always do these programs. Check afewebinars.com all the time. Hope this was good to you. Continued success to all of you. We'll talk to all of you again real soon. Take care, everybody. Have a great evening.